Order, order. Cat Smith to move the motion.
Thank you, Sir Desmond, and it's a pleasure to see you in the chair this morning. And I'm really grateful for this opportunity to have some time to look at a health issue which is often overlooked, misunderstood and under-resourced within our National Health Service, and that's Postural Tachycardia Syndrome, or PoTS for short. It's not a rare disease, yet for too long people living with PoTS have been falling through the cracks of a system that was just never designed to recognise or support them. And the notes that I have today are based on the heartbreaking reality faced by my constituents, the tens of thousands of people across the UK who have PoTS. And I will declare, Sir Desmond, I have had a diagnosis of PoTS since 2012, so some of it is my own experience as well. And the reality... I'll take an early intervention from my old friend.
I spoke to the honourable lady beforehand who says whenever you ask for an intervention, I'll take all the interventions, so I thought maybe I'll be able to get them done early. Can I commend the honourable lady for Lancaster and Rye for her dedication, for her commitment, and it's always something I admire in the honourable lady, and I wish her well in this campaign. Does the honourable lady not agree that the nature of PoTS means that it can be difficult to diagnose, which leaves the sufferer feeling unheard and not believed? And does the honourable lady not believe that the enhanced research into diagnostic tools would ensure that people get the support they need to live with PoTS rather than surviving life with it?
I thank the honourable gentleman for his intervention, and I recognise there's a lot of colleagues here for this debate, and more than I've ever seen for a 30-minute debate before, so hopefully next time I make an application I might be granted a little bit more time. I'm happy to take interventions from colleagues if anyone wants to make an early intervention.
Well, I would.
Oh, there we go.
I'll take that as an invite, can't I? But I'm grateful to my honourable friend for securing this debate. A constituent of mine who has contacted me about his daughter who lives with PoTS and faces exhausting weekly travel for costly private IV treatment due to the lack of local NHS provision. They've now found support in York, but it's still far from home. Does my honourable friend agree that the absence of national clinical guidelines and clear care pathways leaves too many families in this position, and that the government should do more to ensure consistent and accessible care for people with PoTS wherever they live?
I would very much agree with my honourable friend, and will address that later in my speech. I see my honourable friend there.
Thank you very much. Mr Chair, health is obviously devolved to Scotland. However, this is a UK-wide issue. My Western Bartonshire constituents, Ewan, Robert and Louise, are among a group living with PoTS, and they too advise of unacceptably lengthy waiting times for diagnosis, many years, causing untold suffering. Does the honourable member agree with me that greater support for this syndrome is needed right across the United Kingdom?
I thank the honourable friend for that intervention, and the lack of services right across the United Kingdom is part of my speech, and I look forward to that. I'll give away over that direction this time.
Thank you, Sir Desmond, looking suave as ever. And on behalf of many of my Gloucestershire residents, can I thank her for bringing forward this debate. She'll know that PoTS UK reports that it takes an average of 7 years to get a diagnosis, and that actually half of those are initially misdiagnosed with a mental health condition. So considering this additional strain on sufferers and families, will she agree with me that the government should focus on improving diagnoses as a priority? Thank you.
I'll address that later in my speech. I'll go this way.
And for giving way. Like others in this room, I've had many constituents in my constituency of Wolverhampton West asking me to come here to represent them, like one Sophie Evans-Carey, who has spent the last 6 months in hospital, and she just wants to get her life back. So does my friend agree that we need to increase support and services available for PoTS sufferers? Average time for diagnosis is 7 years. We need a quicker diagnosis, proper funding for treatment to enable people like Sophie in my constituency to go back to work and help the economy in the process.
Thank my old friend for that intervention. I'll take another short intervention in that direction this time.
On the theme of this being a nationwide problem, in Northern Ireland, not only does it take 7 years for diagnosis, but we do not, it appears, have a single PoTS specialist, which is aggravating the situation. So if the government is to address this issue, it needs to address it on a nationwide basis, and it needs to give it the urgency and the funding that it obviously deserves and to date has been neglected.
The gentleman's picked up on a theme in my speech later on, which I hope you will enjoy as well. I'll take an intervention from him.
Can I thank my honourable friend for giving way? A decade ago, my constituent Laura Cordell, who has lived with POTS for 10 years, was rushed to A&E with a dangerously high heart rate. She was later told by a doctor she had POTS symptoms, but she was just told to go away and take more salt. And with no follow-up or referral, and over the next 10 years, she sought help on a number of occasions, but wasn't diagnosed, and in the end had to go private for diagnosis, which is obviously not an option available for most. Would my honourable friend agree that we need a lot more research and greater awareness of POTS, particularly among frontline medical professionals like GPs, who are often the first port of call for our constituents?
I very much agree, and I'll take the intervention from my honourable friend.
I'd like to thank my honourable friend for raising awareness about this very important condition, and it's an honour to serve under your chairmanship, as always, Sir Desmond. I'm here because, like everyone else, several of my constituents have raised the problem with diagnosis taking far too long and the difficulty that the crippling impact this condition can have on their lives and the difficulty they have in accessing healthcare. And particularly as the chair of the All-Party Parliamentary Group for Sport, the impact that it has on people's ability to continue to play the sport that they love. And it may be that because they're not being diagnosed, they think it's something that's going to impact their ability to continue their ordinary everyday life. And it isn't right that it takes on average 7 years. And we must put more effort and more emphasis in diagnosis and treatment. And I'd like to thank you again.
Interventions should be shorter. Cat Smith.
Thank you, Sir Desmond. And actually, that intervention was a really important one. It wasn't included in my speech. But as someone who has POTS and has run 3 London marathons, I can say that you can have POTS and be sporty. It is just a lot harder. I'll take an intervention from my old friend.
I'm really grateful for this debate. Dr Gupta is a leading specialist in POTS. However, he knows the physiological changes which are taking place. He knows how to treat it. But he has been stopped from his practice because we don't have the clinical guidelines in place. Must we not ensure that the government now ensure that that happens so that he can continue his practice, which he knows has an impact on patients and indeed they recover well?
What needs to change is those clinical guidelines, and I will address that later in my speech. I'll take the intervention from my friend.
Thank you very much. I share my constituents' concerns about the average time for diagnosis of POTS. 7 years. It's simply too long and it's unacceptable, and that's in Scotland too. And given the limited awareness of postural tachycardia syndrome amongst healthcare professionals, does my honourable friend agree with me that the introduction of one dedicated care pathway across all health boards, including devolved nations, would help to improve early recognition, streamline referrals and ensure patients receive timely and appropriate care?
I very much agree, and I'll take the intervention from my old friend.
I'm grateful to my honourable friend for giving way and for securing this debate. One of my constituents in Aylesbury has become a full-time carer to her 25-year-old son who is affected by POTS, developed it at university, had to drop out, now is unable to work. But does my honourable friend agree that given that we know POTS is most likely to develop in young adulthood, we need a particular focus on that age group as we're thinking about increasing recognition and diagnosis and treatment of POTS?
I thank my old friend for intervention and very much would agree. And I see my old friend just along.
Thank you, Sir Desmond. I'm grateful to my honourable friend and congratulate her on her knee exercises this morning by giving way to us all. Can I just give voice to my constituent Eva from Newcastle Lyme, who has been in touch with me. I met her at a coffee morning recently. Her concerns on early diagnosis, on access to services, and the fact that she's stuck on a waiting list down here in London and has been for a very long time indeed. The situation simply isn't good enough, and I look forward to hearing from the Minister what action we will see, and sooner rather than later.
There is a particular crisis in London which I will address in my speech, which the honourable gentleman might be very interested in. I take the intervention from my old friend.
I thank her for giving way, for being so very generous with her time. But as we can see from today's debate, this is not the rare condition. Maybe some people think it is. It actually affects many, many people, including Helen from my constituency, who lives in Robert Town. She was repeatedly misdiagnosed and has faced years of delays in fragmented care. So can I echo the calls from colleagues for clear NHS pathways, joined-up care and access to specialist support in every region, and also not to underestimate the impact on people's mental health that POTS can have.
Absolutely, I think that's a very good point, and when you're believed by medical professionals for so long, it can affect your mental health. I would recognise that. I'll take the intervention then.
Thank you.
Thank you for giving away. Would the honourable member agree that some of the reports suggest that 50% of the cases of PoTS have been misdiagnosed as a mental health condition, adding pressure onto the individuals and also to the mental health services? So this need to have a more input into support the people with the PoTS.
Absolutely. I thank the honourable friend for that intervention. Would very much agree. And I see the honourable lady over there as well with an intervention.
Thank you very much for allowing me to intervene. My constituent Julie told me about her adult daughter who lives with ME and believes she has PoTS. And after struggling to find a specialist, she finally got a GP referral to a consultant in Bristol who said that PoTS was a TikTok fashion and refused her any testing. She'd spent ages travelling a long wait, quite an effort to get around the building, and she was laid bedbound for weeks as a result of that. And terribly, that dismissive approach had left her unable to feel that she could try to get any other help. So I understand this is not uncommon either, and I just wondered what steps might be taken to ensure people with complex, debilitating conditions can access informed and supportive specialist assessments.
Thank the honourable lady for that intervention, and I will address those points in my speech. If there are no further interventions, it's one of the most difficult things to do when you have PoTS, is to sit and stand repeatedly. So hopefully I get to the end of the speech, Sir Desmond. But colleagues have been really helpful there, because colleagues have highlighted that the time it takes for diagnosis, on average, is 7 years. And the fight for a diagnosis is one of the first fights and one of the longest fights that a sufferer of PoTS will go through in order to be able to even begin to consider accessing services, although that is a different matter altogether. And during that devastating period where you have huge uncertainty about whether or not it is all in your head or you really are fainting, being dizzy, you struggle to access any support and are often disbelieved. And that leads to many sufferers of PoTS being in situations of having to drop out of education, losing employment and withdrawing from social settings, which has an impact on mental health, as my honourable friend did mention in his intervention. And I don't believe it's because doctors don't care. I just think it's because awareness of PoTS remains astonishingly low within the medical profession. Most GPs will never have encountered the term in their training, and even amongst cardiologists and neurologists, expertise in autonomic disorders are scarce, and as a result, patients often find themselves referred between different specialities. So you can be bouncing from cardiology to neurology to endocrinology and psychiatry without any one clinician being there to join the dots and get the diagnosis. And the crisis in access to specialist services has been brutally highlighted this week when we've learnt that in London, a major teaching hospital clinic has closed its doors to new PoTS patients, and a second has reduced its capacity to see only local patients. And all the rejected referrals are now being forwarded to a third London clinic that is already totally overwhelmed and has a 2-year waiting list. So that's going to put extra pressure on them, leaving patients in the South East without any access to healthcare pathways whatsoever. The outcome of this is blatantly a postcode lottery where access to diagnosis and care depends entirely on where you live. This value was summed up in an email that I received last week from someone, and I just want to quote from it. She says, "I would like to note that I got involved with this as I'm still unable to get a formal diagnosis of PoTS while suffering the symptoms. As the only specialist we had in Plymouth retired, and my GP said they were currently unaware of where to send me for help. Please, I'm begging, please help." That is the desperation that many people are going through when they can recognise their symptoms, they can use the internet and are quite confident that the symptoms of PoTS might match, but they have no way to get the diagnosis and then be able to access the support. The crisis has been made even more urgent by a recent surge in PoTS cases that have been associated with long COVID. And clinics that were already stretched thin are now further overwhelmed to do more referrals, and that's adding further pressure to the system that was already struggling to cope pre-COVID. And ultimately, these challenges point to a systemic gap, which is a lack of clinical understanding of the autonomic system, which sits awkwardly between medical disciplines and is often overlooked in medical education. And until that changes, thousands of people with PoTS will continue to fall through the cracks, dismissed, misdiagnosed, and left without the support that they need to live well with a complex and chronic condition. The challenges that I've described are not simply matters of medical complexity. I believe they're also matters of policy and system design, because people with PoTS are not falling through the crack by accident. They're falling through because the system, as it stands, was never built to recognise or support them. Now, PoTS predominantly affects women, and I think that contributes significantly to the fact that it takes 7 years to be diagnosed. And the delay in diagnosis of PoTS is a stark example of a concerning gender health gap in the UK, where many women receive poorer healthcare than men. So I welcome the government's 10-year plan, but I do have serious questions for the Minister about its ability to help the PoTS community. The plan focuses heavily on prevention rather than diagnosis, yet this isn't a coherent strategy for chronic multi-system conditions like PoTS, which often have genetic or variable causes. The NHS cannot just focus on prevention. There also needs to be adequate access to diagnosis and ongoing aftercare for chronically ill patients like those with PoTS, when there is currently no cure. We need to have an explicit commitment on the government's plan to overhaul education and training curricula to create 1,000 new specialty training posts. Whilst it's welcome, will these changes include dedicated education and training on PoTS for frontline clinicians? And will these new training posts include specialists in autonomic disorders? And with the plans, finally, with the plan's commitment to health data research service investment, making wearables a standard in chronic care, can I ask the Minister whether or not this investment will include dedicated research into PoTS, and will PoTS patients be explicitly included in the initiative to provide wearables, which are so vital for monitoring a heart rate-driven condition? So what's clear, Sir Desmond, is that we need change, and we need a clear coordinated strategy that brings together awareness, research, clinical care and social care. So my ask of the government today is clear, but it is fivefold. So first, we need national guidelines, ideally from NICE, to provide the evidence-based framework that clinicians, including our overstretched GPs, need to diagnose and treat the condition. Secondly, the government must require and ensure that commissioning bodies and ICBs execute their strategy duties to understand the prevalence of PoTS in their community and provide the needs for these patients. Thirdly, we need to ensure that every ICB has a clinical pathway and that all patients who require secondary care have access to a high-quality service regionally and not just in central London. Ultimately, it means that the postcode lottery has to end. Fourthly, we must fully support existing specialist services, of which we are currently seeing them being overwhelmed and are under threat from closure by hospital management. And this includes immediately intervening on the London crisis and protecting every single specialist across the country. I know obviously in some of the countries in the United Kingdom, health is devolved and therefore that is more challenging. But this is a UK-wide issue, although I recognise that the Minister's responsibilities are England only. Fifth, I would like to ask the government to make PoTS and related disorders a health and social care priority to ensure that affected people have equitable access to the NHS healthcare and social support that they deserve. I believe that we've got an opportunity to fix a long-standing wrong, and we mustn't allow the thousands of people suffering with PoTS to remain invisible any longer. I'd like to thank colleagues for coming out in numbers that I did not expect to support this 30-minute Westminster Hall debate, but I hope that demonstrates to the Minister the strength of feeling right across the country in terms of all our constituencies have many people suffering from PoTS who are struggling to get diagnoses, struggling to access services, and ICBs are letting down people with PoTS right across these islands. So I would urge the Minister to take this opportunity to take some decisive action and set out why the government is going to take people with PoTS seriously and ensure they're no longer invisible. Thank you.
The question is that the House has considered the matter of support for people with Postural Tachycardia Syndrome. Minister.
Thank you, Sir Desmond, and it is a pleasure to serve under your chairmanship, as always. May I start by congratulating my honourable friend, the member for Lancaster and Wyre, for bringing this very important issue forward. This place is vastly enriched by our experiences, and it is nothing short of inspiring of how her diagnosis has led her to become a passionate advocate for the PoTS community, raising awareness and holding this government to account. I want to thank her for sharing her story and Elise's case with me. I want to assure my honourable friend and Elise that tackling health inequalities is my #1 priority as Minister for Public Health and Prevention. And I also want to thank so many honourable members for their interventions today. I thank them for sharing their constituents' stories. There is not, given the time in this short debate, time for me to respond to each individual intervention, so I won't even attempt to do so. But I'd like to assure honourable members that their points have been noted and that their presence today is testament to how important this issue is right across the House. I recognise that people with PoTS wake up and confront the day, every day, through sheer willpower. When showering, cooking and walking to the corner shop, each become small expeditions that need endless rest and planning. We are determined to help improve your life. Postural Tachycardia Syndrome, or PoTS, as it is more commonly known, is not a rare condition, as has been noted. It affects around 120,000 people in the UK. It's a debilitating multi-system disorder that can significantly impact someone's quality of life. And as my honourable friend points out, the path to a PoTS diagnosis is often a long and arduous one, filled with frustration and misdiagnosis as patients fight to be heard. And even after a diagnosis is made, patients may struggle to access the services they need due to a lack of specialist care and limited understanding among health professionals. This results in long delays in treatment, often leaving those affected unable to work or live their lives. I'm now going to turn to some of the specific issues that she's raised. Let me start with guidance. For too long, patients have faced systemic barriers to care and an unacceptable postcode lottery for support. It cannot be right that in modern Britain, where you happen to be born determines the care you receive. And she rightly points out that this inequality is rooted in the lack of clear national guidance for healthcare professionals. Without guidance from bodies like NICE, clinicians will often lack the confidence and know-how to identify and manage this complex condition effectively. There are some reasons, however, for the difficulty in providing such guidance at the moment, including the amount of available evidence, the fact that PoTS is often managed with lifestyle changes, and the overlap with other conditions like long COVID and ME/CFS. All that can bring similar debilitating symptoms. And all of these issues make developing clear-cut guidance and guidelines challenging. But in its clinical knowledge summary on blackouts and syncope, NICE sets out in black and white a clear definition of PoTS with the right tests to diagnose it and symptom-based management. NICE has also published guidance that mentions PoTS in relation to other conditions, such as its guideline on ME/CFS, acknowledging the overlap between these syndromes. Several other organisations, including PoTS UK and the International Heart Rhythm Society, provide information too. But services for long-term conditions like PoTS are commissioned locally through integrated care boards. This approach gives local clinicians the flexibility they need to tailor services to the specific needs of their communities. And providing PoTS specialist services is a fundamental part of the ICB's statutory role in planning and delivering health to the people they serve. And when an ICB fails to meet its statutory functions, NHS England has a range of proportionate enforcement powers. Let me be really clear. We expect NHS England to hold ICBs to account by demanding that they provide clear assurance on how they are meeting their responsibilities. And where they are failing people with PoTS, let me say this very clearly, publicly now. We expect them to rectify this.
For comments, I wanted to intervene on the point of ICBs because many ICBs have absolutely zero options in terms of pathways, and I was going to ask the Minister what steps she's going to be able to take to make sure that they're forced by NHS England to do so, and I thank her for her comments that she made.
I thank the honourable member for intervention. But as we know, guidelines are only as strong as the evidence and research that they're based upon. We need systematic, robust data to determine what treatments and interventions are most effective. So while we're backing our life sciences sector to come up with tomorrow's treatments into long-term conditions, we're also funding research directly through the National Institute for Health and Care Research, the NIHR. They're currently backing a study known as the Locomotion Study, with over £3 million to examine the connection between long COVID and autonomic nervous system disorders, especially PoTS. The NIHR funds research proposals through open competition, It's based on their scientific quality, value for money and the impact on patients. It's really clear that the NIHR welcomes proposals for research. And I want to use this debate to appeal to any researchers who may be following this debate. If you have a proposal for PoTS-related research that this government could fund, please do apply. We want to see those proposals and we want to be able to fund those that can be brought forward. Your work could be life-changing to thousands of people across our country. So Desmond, locally developed care pathways are clearly important for supporting people with PoTS because they help address the condition's unique challenges. I shall.
Minister giving way. However, across the country there are very few specialists in the field of looking at PoTS. Would she be prepared to meet with those specialists to hear as to why they are facing barriers and to work with them to ensure that they can practice the medicine they know works?
I thank my honourable friend for her intervention, and she preempts the end of my speech, where I say I would be more than happy to meet with specialists in this area to discuss how we can move forward, because I think it's really important, Sir Desmond, that today's debate becomes the beginning of our conversation, certainly not the end of it. And this government is focused on standardising and coordinating care across different settings so that local pathways can address systemic challenges, especially the inconsistent referrals that so many people with PoTS face and that has been raised today as an issue. I shall.
Thank you very much for giving way. Between young people unable to finish education and adults unable to cope with the strains of the workplace, the economic impact of PoTS is undeniable. She speaks really clearly about the pressure her department will put on NHS England. Will she also put pressure on the Treasury with regards to its economic obligations?
Minister. I thank the honourable member for his intervention. As he's probably aware, this government is working really hard on developing policies to support people into work, particularly people with health conditions. And these issues are being raised through the Get Britain working paper, which which honourable and right honourable colleagues in the Department for Work and Pensions are bringing forward, and working to support people with all long-term health conditions, including PoTS, is a crucial part of this government's effort to improve the economy and get Britain working, and his comments are noted. We're also determined to improve patient outcomes and ensure that a more tailored and efficient care that acknowledges the complexity of PoTS beyond just a single specialty. The government's 10-year plan for health doesn't only deal with prevention. The plan does offer potential for people with PoTS through the increased focus on community-based care from hospital to community, through the better integration of services through that, and through our analogue to digital shift to improve digital tools. And given that PoTS is frequently comorbid with ME-CFS, the final delivery plan for ME-CFS, which the government published this summer, will have a positive impact for many PoTS patients too. I'd like to end by once again thanking my honourable friend for bringing this debate forward. And as I said, I hope that this is the beginning of our conversation and that we can continue to discuss how we can ensure we are delivering for people with PoTS as we work towards building our NHS fit for the future.
The question is that this House has considered the matter of support for people with Postural Tachycardia Syndrome. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. Order, order.